So breathing is something that we take pretty much for granted, and it's something that we obviously do every single day. The following videos will help you to assess how you breathe, and then there are a series of other exercises to help improve that pattern if it's not optimal. These are really important to do and will make a huge difference to you. So if you can sit yourself in front of a mirror so you can actually see where you're breathing from, I'm going to ask Laura to take a really nice breath in. And things that you're looking for is where the expansion comes from in your chest. Many people will start to breathe from the top of their rib cage. So many people may breathe in and lift their shoulders. Many people get really tense around the neck when they breathe, particularly if you're asthmatic. Where we're actually looking for the breathing to come from is some rib expansion from down here. You'll have heard the term belly breathing, and that quite often is faulty because all you're doing is sticking your tummy muscles in and out. So for Laura to start retraining this, if you move your bottom forward on the chair, you want to put your hands on your lower ribs, but I'll do that for Laura this time. So if Laura takes a big breath in and breath out. And what you're wanting to see is these lower ribs expanding and then relaxing down again. It's not a forced expiration, but as you breathe out, your rib cage will relax down and the muscles will relax, which helps. So it's a nice inhale and a really nice exhale. If you're getting some of the movement from here, you want to try and relax this piece first, so you may also want to put a hand on the top of your rib cage to keep this area relaxed. So another neat little trick that you can use to help you work out where your breathing's meant to be coming from is to use your TheraBand placed around your lower rib cage. And you can obviously hold this with one hand. And if I ask Laura now to breathe in from her lower ribs, you can feel the resistance of the TheraBand. So it really gives you a good proprioceptive awareness of where your breathing's meant to come from. If you struggled with the breathing test that we did earlier and you really found it difficult to get the breath to come from your lower rib cage, I would advise you to start this exercise lying on the floor so you can really correct your breathing before you move it into a more functional position. So I would ask you to lie on the floor with your knees bent up so you can be really nice and relaxed. I want you to have enough support under your head so that's well supported without your neck being tipped up too high. A number of us are quite tight around the front of the neck, so it's really important you get that position right. You ideally want your shoulders to be nice and relaxed. So I'm going to ask you to do exactly the same breathing that we did earlier. However, being in this position should make it a lot easier for you to do. So I'm going to ask Laura to put her hands on the top and bottom of her rib cage and then take a nice breath in. And she should be able to feel where that movement's coming from by the movement of her hands. And you can see here she's getting some movement from the top of her rib cage, so we can ask Laura to try and then relax this area and take another nice breath in, aiming to get most of the movement from the lower ribs. And you can see by the movement of my hand that there's more movement coming from here. You're also aiming to keep your neck nice and relaxed and your shoulders nice and relaxed when you're doing this. So you may find that this hand position doesn't work for you, in which case you may want to put a hand on either side of your rib cage. What you should feel as you take a breath in is that your hands come further apart and then come back in again as you exhale. So they're widening on an inhale and coming together on an exhale.